Hi, my name is Kathryn Zumberg, and I'm with the Andrew Kukas Foundation for Social Anxiety. This month I chose an article for professionals that examines a new treatment, which is a computerized intervention that focuses on interpretation training for individuals with generalized social anxiety disorder. And this article was published in 2012 by Amir and Taylor. And it focuses on treating sort of this interpretation bias that's common among those with social anxiety disorder. Before I continue and describe a bit more about the study, it's important probably for me to describe for everyone what an interpretation bias is and why the authors selected this as an important target for their intervention. An interpretation bias is a bias that a lot of people with anxiety disorders exhibit, particularly those with social anxiety disorder. This is a bias where ambiguous situations are interpreted in a threatening manner. For those with social anxiety disorder, theories, especially cognitive theories of anxiety, argue that individuals have a tendency towards interpreting social situations in a threatening manner, which leads to greater avoidance of social situations. And this is done in an effort to kind of reduce or avoid distress. Therefore, a lot of interventions that are based upon cognitive theories really do target this kind of interpretation bias by doing things such as exposure. In this study, though, they decided to target this interpretation bias with computerized intervention that basically trains individuals to interpret things in a different manner. Based upon that, there was two goals for the study. The first goal was to examine the effects of this computerized intervention on anxiety symptoms. The authors hypothesized that the intervention would change individuals' interpretation bias, which would in turn reduce anxiety and impairment due to anxiety. The second goal of the study was to examine whether this brief intervention had any impact on depression and/or trait anxiety. The authors examined these study goals by conducting a randomized controlled trial. What they did is they recruited people from different sites, and then they verified that individuals had the generalized form of social anxiety disorder. For those that are unfamiliar, the generalized subtype of social anxiety disorder is the subtype where individuals experience a lot of fears across many different social situations, rather than having a more circumscribed fear of one social situation, such as public speaking. And then what they did is they verified that those individuals met other study criteria. And then if they did, they were asked to participate in the study and were assessed with several self-report measures as well as clinician-administered measures of anxiety and depression. Individuals were then randomized into either the computerized intervention or a placebo group, and they were then reassessed after completing 8 to 12 sessions of the intervention or the placebo. Individuals were also asked to complete follow-up assessments 3 months after the intervention was completed. So, to describe the intervention a little bit, the intervention was a computerized task that the authors called IMP, which stands for Interpretation Modification Program. The task presents individuals with a word which is either neutral or threatening, and then a sentence that describes an ambiguous social or non-social situation. After the sentence is presented, individuals are asked to indicate whether the word and sentence are related by pressing a key on the computer. Individuals are then reinforced with a statement that indicates that they were correct when they made a neutral interpretation, and were punished with a statement that indicated they were incorrect when they made a threatening interpretation. So the idea here is that it would train individuals to interpret things in a more neutral manner by giving them some positive reinforcement, like, woohoo, you did it, good job, versus the negative reinforcement of, incorrect, when they actually interpreted things in a more negative manner. The placebo intervention was similar to the intervention, except that it had different reinforcement and punishment schedules. So where the intervention itself pretty much reinforced the neutral interpretations and then punished the threatening interpretations, the placebo actually did it half and half. And that way it wasn't clearly training people to interpret things one way versus the other. There were 4 main findings of the study that I think are important to draw your attention to. The first is that the results of the study demonstrated that the intervention did produce changes in interpretation bias on both social and non-social situations. After completing the sessions, those that received the treatment made less threatening and more neutral interpretations. The authors did find that the placebo intervention also produced some changes on interpretations, but not as much as the active intervention. And then after completing the intervention, individuals receiving this intervention, they also experienced less impairment due to anxiety than the group that was receiving the placebo. So not only are we seeing this difference on interpretation bias, we're also seeing a difference on the amount of impairment due to anxiety. Another finding was that after completing the intervention, individuals receiving it also experienced less depression and trait anxiety than individuals who received the placebo. And the last finding that I think is important to mention is that, remember, the authors did this 3-month follow-up, and the researchers found that those receiving the intervention not only maintained their gains in anxiety and impairment, but they actually continued to improve. Unfortunately, the same was not true for depression. I want to briefly discuss the clinical implications of the study. I think the study is a really nice one in that it provides support for cognitive theories of social anxiety disorder and strongly suggests that working on modifying individuals' biased interpretations of both social and non-social situations can be beneficial. Moreover, the results demonstrate that change can be made via computerized intervention that could be delivered as a standalone treatment or as part of a more comprehensive therapy. I think this is really interesting because it suggests that in this busy life that everyone has these days, that there may be opportunities for different forms of therapy that can be brief and that can be delivered through a computer. If you're interested in learning more about this study, you can find the write-up of this under the research section on the Andrew Kukas Foundation for Social Anxiety website. In addition, there's some links there within the write-up where you can read more about Dr. Amir and his research, and you can read more about these kinds of computerized interventions. Thank you very much, guys.